when I joined neurosurgery in the year 1994, so for your information, neurosurgery training is a 6 years training after 5.5 years MBBS. So it's really a championship game at the end of the day. So I did my neurosurgery training at the main Manipal Hospital, Airport Road, Bangalore. And I trained one of the two best neurosurgeons in India at that time, Dr. A.S. Hegde and Dr. Venkatramana. They are my gurus, we learned so much from them. And so I was so excited when I got it. I did train for about 11 months. I did an SHO in neurology in NIMHANS before that. I had some time between the exams and I said, let me do something in neurology, and I just went and did that there. And then once I joined here and I started seeing patients, that's when I actually connected to the ground of what's happening, and then started seeing surgeries. But all surgeries were not giving the outcomes, dramatic outcomes that I thought was going to happen. See, it was my lack of information. Especially when you have strokes and head injuries coming in critical, unconscious, comatose and things like that. So we would operate and things were not going great in many times. And many of them had to get discharged in a semi-conscious situation. But 3 stories actually impacted me at that time. This is between the year 1995 and 1997. I was in my second, third year of my training to be a neurosurgeon. And first one was an IT professional's father, who had a brain hemorrhage on the right side, of the brain, and he had left-sided stroke, and he was semi-conscious. The clot was not big enough to operate, so we were trying to dissolve it with the medicines, and he was initially in the ICU and then came to the ward, and I was the doctor in charge of the ward. So, when patients are there for a long time, weeks together or months together, you get familiar with the caregivers, they become like your friend. I was a junior guy. So one day that IT guy came and asked me, the son came and asked me, why don't you do a scan to see what's happening? Why he asked that question was, normally we learn from our seniors that if you don't operate on the clot, it dissolves in 8 to 12 weeks. So that's what we used to parrot to those families. So, and he asked me that question, then I asked my chief, I said, what do you think? He said, okay, get a scan done. And then I went and got a CT scan done. And for my good luck, the clot had dissolved, significantly. And as a small neurosurgeon in training, you feel that you have done something about it. So I was so excited about it. I went and told him, listen boss, the clot is dissolved, very triumphantly. And he asked me a very straight next question. Then why is my father not talking? Why is he not walking? And that hit me like a truck. I said, what is he saying? And that moment, what I got in my brain is that physical healing is not equal to functional outcome. What did that son think? The son thought that the moment the clot dissolves, my father is going to wake up, he is going to get better, he is going to talk, he is going to walk, I put him back home and get back to work. Fair assumption, truthfully, because that's what we communicated, but the lack of communication, that we didn't say that. And then he was so upset with us. He said, what do you mean the clot is gone, my father is the same, how my job is at stake, and he was very agitated about it. That's the first learning. Second learning was, at that time, this is pre-mobile phone era, think about it. And I was on call that night, and there was a guy under the influence of alcohol had a crash, and the police picked him up from the road. He was lying unconscious there and brought him to our hospital. And at that time, when he didn't have any ID with him, so he was unknown. In our world, if patient is brought like that, he's unknown. And for us, the hospital management is very nice. They had left us clear instructions that anybody brought in unknown, but needs to be life-saving. Don't worry about the family, don't worry about the money. You go ahead and get what is to be done. I got a scan that he had a large clot in the brain, he needed to operate, but I signed the consent form for surgery. Think about it. As a life-saving measure, the surgeon himself signed the consent form. I took him to OT. I operated him. Post-surgery, by the time we finished all of that, the family got traced by the police and from the other hospital staff. And then eventually, over the next maybe 4 to 8 weeks, the guy got better, woke up, started walking around, talking a little bit, but he had a lot of memory, behavioral issues and all of that. I eventually discharged him and sent him home. Okay. One day, the wife came back for a follow-up, and she asked me the question, why did you save my husband's life? You should have allowed him to die. I said, what? It just hit me. Till that time, I was like, see, we're just getting to be neurosurgeons. You're feeling like a hero. You have saved so many people's lives. And it was like a slap on my face. I just paused and I said, why, ma? What happened? He said, no need, doctor. See, this guy can't manage himself. On buddhi sarigilla. He can't even manage himself. Hallu jakagala. He can't even manage himself at home. Forget about him going out to earn money. Now, because he can't manage himself, I can't leave him at home and go and earn money for the family. Now, because of this situation that I'm in, I've had to remove both my daughters from school because I don't have money to pay the fees. I said, what have I done? I thought I was a hero by having saved the patient's life, but on the contrary, it has impacted the family negatively. She said, if he had died, I would have got his job. At least my children's life I could have taken care of. This stupid fellow has only spent all his money on drinking. He has never saved for the family. Doctor, she asked me that question. So I realized that just operating and saving somebody's life is not good enough. It may be good enough for me, but not good enough for the family. Number two. Number three was a young businessman, just 6 months married, his wife was 3 months pregnant. He had a bad head injury. He had a clot on the left side of the brain. And just for your information, left side of the brain controls right side of the body. Left side of the brain also controls the speech areas. So he had a lot of clots, and there are two speech areas. One is for understanding, other one is for speaking. And both areas of the blood clot, my senior surgeon went and operated him. And beautiful post-op scan, pre-operative scan, clot, post-operative scan, no clot. That means operation successful. And then this guy eventually came out of ICU, ventilator, consciousness, and eventually walked out of the house. One day he came back for a follow-up, and I saw him. This man is walking around, but he has zero speech. Either he is understanding what anything anybody is saying, nor is he able to speak. He does not even respond to his own name. So if his wife calls him up by name, Suresh, he doesn't turn back. She has to physically go hold him by the collar and bring him back. He's not recognizing his children, his child that was born. He's not recognizing the wife. I said, what have you done? We have given this family an animal. Because what distinguishes animals from human beings is communication. And with this guy's communication is gone, what's the point? That's where we got stuck. When I saw this, I realized that just surgery and saving patients' life is not enough. We need to do much more than that. That's when I actually started asking, and they said they need rehabilitation. And that's when I actually heard the word rehabilitation. Then I realized that just operating is not exciting for me. That's not the dream I want to live. My dream was not to operate. My dream was important to get people back into their lives. And then that was the first seed that got sown in my brain to know what more can I do to make this happen. And that initially just remained a small worm at the back of my mind, looking at it. And eventually, maybe 10 years later, it morphed into a decision that I had to make, that nobody else was taking the serious decision of making this happen. I said I had to bite the bullet and said I have to do it myself. And that was the start of PRS Neurosciences as an idea.